Okay. Good afternoon. Today I'm going to talk about cardiovascular system, and especially the heart and the pump. In my previous lecture, I described the heart anatomy. The heart is made up of 4 chambers. We have right, left atria, and the ventricle. Okay. This is the anatomy of the heart. Looks like that. You have, this is the left atrium, and this is the right atrium, and this is the ventricle, and this is the left ventricle. There are factors affecting the heart rate and cardiac cycle. Now, in our hearts, when our heart contracts, it pushes the blood from the atria into the ventricle, and then from the ventricle, blood is injected to all parts of our body. Now, blood returns from all parts of the body into the right atrium. Here, it returns from all parts of the body and gets into the heart through the right atrium, and it is distributed from the left ventricle here to all parts of the body through the aorta and through the carotids. Now, during heart contraction, atrial systole, and the atria contracts, and this contraction is called atrial systole. Systole is contraction. So when the atria contracts, they push the blood into the ventricle, and there are valves here, a valve called tricuspid valve, and you have the mitral valve. These valves here, these two valves here, what happens is, these two valves, when the atria contracts, these two valves, they open, and the blood rushes into the ventricles. And this is the reason why we hear heart sounds, and these sounds are produced by vibration of these two valves, mitral and tricuspid valves. Now, they close. When they close, vibration produces sound, and that sound is called the first heart sound, or crook sounds. It is like that. First, and another sound. So, the first sound is due to the opening of the closing of mitral and tricuspid valves. There are other two valves here. This is another valve here. It is called aortic valve, and you have the pulmonary valve. Pulmonary going to the lungs. Okay, pulmonary valve. Now, during ventricular systole, the ventricles contract and they push the blood into the lungs or to the aorta and to all parts of the body. Now, during ventricular systole, the ventricles contract, pushing the heart, pushing the blood into the lungs or to all parts of the body. And the sound produced by the closure, vibration or closure of the pulmonary valve and aortic valve is known as the second sound. A third sound is produced by the rush of the blood from the atria into the ventricles, left ventricle, and that is a third sound. There is another fourth sound, and it is not easily heard in all people except in the young people. So, blood, the systole, during systole, blood, the blood go to the body. And the question is, what is the amount that comes into the left ventricle? And what is the amount of blood that remains in the left ventricle? The amount of blood during diastole in the left ventricle is about 130 ml. And this amount is called in diastolic, systolic, diastolic volume, in diastolic volume. And the amount of blood that remains, the amount of blood that is ejected during systole is called stroke volume. And the amount of blood that remains in the ventricle after systole is called in systolic volume. This one is about 50 ml. And this one is about 70 ml in a 70 kg young man. Now, there is another element here that can be calculated in these volumes that is called ejection fraction. And it is a useful index that is used to measure ventricular function. So, what is the ejection fraction? Is that percentage of blood that is ejected out into aorta. So it is calculated. It is stroke volume divided by in diastolic volume, multiplied by 100. The normal is around 65%. When ejection fraction decreases, your ventricles will fail and you will have problem like during anesthesia, for example. A patient with an ejection fraction of 30, I will definitely refuse to give anesthesia. 30, for example, 30%. I will definitely refuse using this. So ejection fraction is a useful index of measuring the ventricular function. Now, how do we measure the cardiac output? We say the amount of blood ejected from each ventricle per minute, per unit of time, is called stroke volume. So, how do we measure the cardiac output? How do we measure cardiac output? So, cardiac output is measured by somebody called Pick's principle. It is measured by using Pick's principle.
Fick's principle says the amount of a substance used by the body is equal to that amount used, say for example oxygen per minute, divided by the arteriovenous difference times to the flow. That is what the Fick's principle says. Supposing the amount is 250 ml of oxygen divided by 190 minus 140, what will come of this is around 500 liters per minute. This is the cardiac output. Our heart outputs 5 liters of blood per minute. So this is the Fick's principle. So you have to know how many liters of blood per minute your heart pushes out. So there are factors affecting cardiac output. Cardiac output equals heart rate times stroke volume, or cardiac output equals heart rate times systemic vascular resistance. Any factor affecting this decreases cardiac output. Say for example, when cardiac output increases, heart rate increases, your cardiac output increases. And factors affecting heart rate are like emotions, and emotion, for example, fear, anxiety, and venous return. Any factor affecting heart rate affects cardiac output. So cardiac output is affected by a lot of factors. Say for example, ventricular contraction or the stretch of the ventricular myocardium. So the amount, the strength, when you increases the strength of contraction, stroke volume will increase and cardiac output will increase. And that is what I want to share with you. Thank you. Thank you, man. They have interrupted me a lot.